Pass. Who wants to start?
Have you guys made a presentation, or are you just gonna tell something?
We did a presentation.
Yeah,
Okay.
we are too.
Do you have a presentation or not?
No, we just have Marilanu in Word.
In
Just a
Word.
document.
Okay.
I have a document with the
Okay.
information. Yeah, now we have to.
Below it a button.
Should I try to share my screen, or I don't know how, but
I have it. Do you can see it?
Yes.
yes.
We can start it. Sure, we can start it, our presentation about diabetes in Austria. We can talk about numbers, some facts about diabetes in Austria. Where we go. Every 10 person in Austria suffers from diabetes. Unless a third of those affected don't know anything about the illness. Every 50 minutes in Austria, someone dies from the consequence of diabetes. That is 10,000 persons a year. This means that more people in Austria die each year from diabetes than from colon or cancer breast, and much more than from road traffic. Every 300 people with diabetes get dialysis because of their kidneys failure. That is 26 of all patients who are new to dialysis. Every year, 300 people with diabetes get to dialysis because of their kidney failure. Every year, 200 people in Austria go blind as a result of diabetes mellitus in Austria. We can talk about the development, where we go. Actually, there are currently 100,000 people in Austria with diabetes. In 2005, 55 years, there will be more than 1 million people. Between 85 and 19, of persons with diabetes have kind 2 diabetes. Every 10 pregnant women is affected by gestational diabetes, actually. Overweight and obesity, as well as a sedentary lifestyle, increase the risk of diabetes type 2. Around 50 of all people living in Austria are less overweight or obesity. Overweight is also steadily increasing among children. Around 30% of children in the third school year were overweight or obese in 2017, and the trend is rising. The information have shown for Österreich's Austrian Diabetes Society. How much is it? How much are the costs? The cost in Austrian of diabetes are around 3 billion euros. I don't, more or less. The majority of the costs are incurred for the treatment of late complication of diabetes. In 2019, more than 716 euros were spent on diabetes worldwide in the world. What can I do in Austria when I receive a primary diagnosis about diabetes mellitus? What can I do? I need the help. The most popular association in Austria is the Austrian Diabetes Society. Her mission is to provide health on quality of life of living with diabetes in Austria. One does the Austrian Diabetes Society what offer. It services go with especially program between patient on treatment. It provides relevant and quality information for persons with diabetes. It organizes advanced trainings for medical personnel, doctors, nurses, and the diabetes advisors, and the etiology too. It organizes national citizen education meetings. We have to support the electrology research in Austria with patient doctors for 4 years ago. It serves as a reference for all topics, health insurance, the Federal Ministry of Health, and it makes to date guidelines, communication with Austrian health politicians, etc. At the second place, we have the Austrian Diabetes Association. They cooperate between experts and they inform on trained persons with diabetes on their relatives. The objective get under control in every life and prevent consequences more seriously. What can it offer? They make actions of experience over 50 groups, more or less. They inform about events, about the Austrian days, for example. They have age service center and make individual advices online too. Training for children from age to 12 years and younger from 13 to 18 years or less. They offer also family training, weekend, magazine. They have counseling in every school. This is a project in Vienna. They have diabetes nannies too. They accompany children and their families with talking about this complicated situation. What can we have more place to go for help too. You can receive information about this illness through your doctor or your private clinic. your public clinic. They are another association, Actives Device Austrian. This is they are association who organization of physical activity with group for all, with everything, with everyone. There are we have so a journalist group. We have two of the International Diabetes Federation, and through prevention we have programs of the Ministry of Health and Society in Austria. Patients receive information at the hospital through nurses' expertise, for example, and we have to many digital platform, Diabetes Feed, Diabetes Initiative und Diabetes Health, zum Beispiel, for example.
Yeah. Thanks, Sandra. I have the part of the therapy. And yeah, if diabetes is diagnosed, patients should take part in diabetes training. You will find out everything you need to know about your illness, the possible symptoms and consequences, and the treatment options. In addition, diabetics learn in the training what can lead to sudden complications, such as hypoglycemia, or what to do then. And yeah, the therapy of diabetes mellitus aims to lower the increased blood sugar level and to prevent the harmful consequences of diabetes in blood vessels, nerves, and organs. On the one hand, this should be achieved through non-drug measures. Above all, proper nutrition and sufficient exercises can improve blood sugar levels. And regularly measuring the blood sugar level helps to keep track of the course of the disease. You should keep a diary for a better overview. All measures, values are logged there, and you can also enter other important parameters, such as the use of dosage of blood sugar tablets, or insulin or blood pressure readings. Yeah. Diabetes treatment often requires additional diabetes medication, such as anti-diabetic drugs, oral preparations like blood sugar lowering tablets, and insulin, which must be injected. Yeah. Which anti-diabetic agents are used in individual cases depends on the type of diabetes and the severity of the disease. Yeah, with a healthy, as we already know, with a healthy diet, sufficient exercises, and independent blood sugar measures, the patient can actively influence the success of the treatment. As a result, secondary disease of diabetes, such as foot amputations, blindness, heart attacks, and strokes, can be avoided. The standard here in Austria is initially be treated with a lifestyle change. You try to adjust your weight and change your diet. Yeah, you should also do a lot of sport. Yeah, and if this is not enough, you can try metformin as a basic therapy if there are no contraindications for metformin. And if this is not enough, a distinction is made between two ways. The first is history of known cardiovascular disease or chronic renal failure. And the second is no known cardiovascular disease or chronic renal failure. In both categories, we try to achieve a normal HbA1c value and we try to find suitable medications for the individual patient. Examples for this are GLP-1 analog with cardiovascular benefit or SGLT2 inhibitor with cardiovascular benefit or SGLT2 inhibitor with evidence of reducing heart failure and or progression of chronic kidney failure. But the therapy depends on the previous illnesses. And the final step in our there are specialists here who draw up a scheme of how much insulin the patient needs to inject at which value. Yeah, that's it.
Thank you very much, Pia.
Okay, thank you.
Thank you.
Do you have any questions?
Yeah, any question?
I don't know. Do you have, Lynn?
No.
Is everything clear for you?
Yeah.
Yeah, I think it's a bit similar to our country,
Mm-hmm.
I think so. Yeah. I think it's not.
but maybe you
different.
have like different numbers or
Yeah,
Yeah.
of course.
yeah.
Okay, then let's start.
Yeah.
Kan je het delen?
Er staat host disabled participant screen sharing.
Yeah, below it's a button that says screen sharing. You can click on it. I know.
Die groene?
Below. Below.
Yeah, but it doesn't work.
Next to chat.
Yes, but mine says something. I'm gonna share a picture in the group.
Maar je hebt die groene waarop staat share content, is dat het niet?
Yeah.
How host disabled participant screen sharing.
I don't know.
Maybe you have to allow it, Sandra.
I don't know. This yeah, I don't know. You can send it per email. Can you send it?
Oh yeah.
Per email? I can it, Mike. For you.
Oh my god, my Wi-Fi is so bad.
I choose her today. I don't know why.
Yeah, we don't have like a presentation as
Just the
like you.
documents.
Yeah.
Mhm.
Oh, Marjoleine zegt dat hij niet verzonden kan worden.
I don't have it.
No, it says it doesn't send.
Ja, dan moet je denk ik een kopie sturen, niet zeg maar. Want anders komt ze ook in het.
Ja, ik ga nog even
Can
proberen.
you provide with my address with another email?
Yes, I'm gonna try something else.
Wacht, ik kan hem ook wel proberen te sturen.
Ja, probeer maar, want mijne wil niet openen.
Yeah, we have like a problem with the sending.
Okay. I can provide it with my another email direction.
Ik denk dat ik het wel kan sturen.
Wacht, ik heb een heel kras. Oh nee, er staat bij mij dat het niet lukt.
My Wi-Fi is here so bad. Oh.
It just
Okay, I think I sent something.
okay. Wait. It takes a while.
Oh.
I don't have.
Stuurt hij?
I don't.
Nee,
Mm.
doe ik even haar andere e-mail. Oh ja, dan moet ik natuurlijk met mijn eigen mail doen. Okay, I will try one more time and if it doesn't work, we just gonna tell.
Ja.
Okay.
Lukt het?
Yes, I think so. I send it to your Gmail now.
Okay, I try. Mhm. Oh, it's there. It's the yep. I have it.
Nice.
Yes. Mhm. One moment, please.
Mary, do you have a Coke glass?
Hmm?
Do you have a Coke glass? Like
Yes.
that? It's green, oh my god. Sisters.
Okay, do you say it?
Yeah,
Oh,
I can
yes.
see it.
Yeah.
Can
Okay.
you make it a bit bigger, please?
Bigger. Yes. Please.
Maar mijn scherm wordt niet zo klein. Nou,
Ja, ik heb gewoon
maar
ik heb gewoon de dinges ernaast, wat wij zeg maar gewoon.
ja, alleen mijn scherm is niet helemaal ingenomen, dus het lukt niet. Okay, I'm just gonna start with it. This is a graphic from people with diabetes in the Netherlands. In 2019, about 1.1 million people with diabetes were known to their GP. Of these, more than 600,000 were men and more than 500,000 are women. Diabetes is more common with men than with women in almost all age groups in the Netherlands. The graph shows it. In 2019, 500,000 new patients with diabetes were diagnosed. These are 29,000 men and 22,000 women. The number of age increased with age. At almost all age, the number is higher for men than for women. In the Netherlands, 1 out of 14 people has diabetes. We have, I think, 17 million people in the Netherlands. And more than 1.1 million have pre-diabetes in the Netherlands, and that's a precursor to type 2 diabetes. There are also people with diabetes who don't know it yet. About 53,000 Dutch people a year hear that they have diabetes. That's more than 1,000 people a week, and more than 150 people a day. 9 out of 10 people with diabetes have type 2. And from the people in the Netherlands above 45, 1 out of 3 is expected to develop type 2 diabetes in the future. So that's quite a lot.
Okay, so we have the mortality rate. Does my doet hij het nou? Oh ja, wel. Ja. In 2019, 2,713 people with diabetes died. People with diabetes died as the underlying cause of death. So they had diabetes, but they died from a complication of diabetes, I think. These were 1,339 men and 1,374 women. And this increases as people age. Yes, you can see it in the charge a little bit. And well, the highest mortality from diabetes is registered in Amsterdam. And the lowest mortality is reported in the middle of the Netherlands a bit. More than 11,400 people died from diabetes in the period of 2013 to 2016. This is an average of 2,850 deaths per year. Okay.
Now the consequences, around 40 to 56% of the people with diabetes suffer from one or more chronic complications because of diabetes. Often even before the diagnosis of diabetes is made, because people walk around unnoticed with diabetes for years. And here are some numbers. 10 to 43% of the people with diabetes develop a cardiovascular disease. 1 out of 10 deaths from cardiovascular disease is due to diabetes. 4 to 46% of people with diabetes have eye problems. After 20 years of type 1 diabetes, is this 82%. 5 to 40% of people with diabetes have kidney damage, depending on the number of years of diabetes. 6 to 34% of people with diabetes have affected nerves, also depending on the number of years of diabetes. And up to 8% of dementia cases are due to diabetes, because people with diabetes are twice as likely to develop dementia and brain damage. And 1 out of 6 people with diabetes suffer from depression. That's twice as often as the general population. Yeah, you can scroll down. Yeah, this is the hospital admissions. The graph shows that in the Netherlands there are 7 hospital admissions per 10,000 people. And the second one in the graph is Austria, and that shows there are 26.6 hospital admissions per 10,000 people. And in 2017, there were more than 10,000 hospital admissions for diabetes, more than half of which are for men, 60%. And the number of admissions may exceed the number of admitted persons, because a person can be admitted several times a year. Yeah, you can scroll down. That's not important, I think.
This the healthcare expenditure by sector. In 2017, the expenditure, I don't know if I pronounce it good, expenditure on diabetes care amounted to nearly 1.6 billion euros. This is for type 1 and 2. In total, expenditure on diabetes care represented 1.8% of total expenditure on healthcare in the Netherlands. 38% of the cost for diabetes are spent on medicines, and 31% on primary care, and 14% on hospital care. The cost partly includes the expenses from the treatment of complications of diabetes. The calculated 1.6 billion euros is therefore the lower limit for the cost of diabetes. There is no good insights into the exact cost of the complications, because they are often registered under other diseases. And then we have healthcare expenditure by age and gender. The spending was on diabetes was about the same for women as for men in 2017. The peak in expenditure is at lower age for men than for women. Most diabetes care expenditure goes to people between the ages of 60 and 90. Well, the prevention of type 2 diabetes mainly focuses on lifestyle factors. There are many initiatives that focus on healthy lifestyle and achieving a healthy weight. These initiatives are mainly focused on high-risk groups, such as people with pre-diabetes, people with a high risk of cardiovascular disease, and people who are overweight. The best-known Dutch lifestyle intervention for people with pre-diabetes took place as part of the study SLIM, and that stands for Study on Lifestyle Intervention and Impaired Glucose Tolerance Maastricht. Type 1 diabetes does not seem to be preventable. The prevention of the autoimmune reaction against the beta cells is, for example, by means of immunotherapy. Other studies on prevention of the type 1 focuses on environmental factors, for example, the time of introduction or the omission of cow milk in the foods of children, infants, babies. There is no systematic screening for diabetes, but there are several screening initiatives. For example, the revised NHG standards diabetes advises GPs they take blood samples every 3 years in patients with an increased risk of diabetes. These people are over the age of 45 with type 2 diabetes in the family, an ethnic burden, obesity, high blood pressure, cardiovascular disease, or lipids metabolism disorders. The standards also recommends checking the blood glucose levels of women who have recently experienced gestational how do you pronounce that? Gestational diabetes.
It's okay.
Pregnancy diabetes.
Yeah.
Gestational, I think.
Gestational, yeah.
Gestational.
Yeah. Okay, foundations and organizations. In the Netherlands, we have several patients, organizations, associations for all ages. But the largest and best known organization in the Netherlands is the Diabetes Organization Netherlands, the DVN. There you can find information about diabetes, practical tips, for example, about insurance, and adequate educational courses. And there are also several foundations, for example, the Bas van Goor Foundation. Bas is a former top volleyball player who, despite having diabetes, played in the Dutch volleyball team. He's committed to improving the quality of life for people with diabetes, especially for children. and through sports. So he organizes several times a year sport events for the children. And also on various sites, people can find more information about, for example, new studies such as diabetes type 1.nl or diabetes steppins. There are also sites for youth and young children. And yeah, so there are a lot of sites. Insurance, diabetes often leads to higher health costs. It's therefore good to know exactly what the basic insurance reimburses. Diabetes care aids are reimbursed from the basic insurance. You do need a referral from a doctor or nurse. Like an insured person, yeah, maybe has okay, and it has to have type 1 diabetes or is treated with insulin. Or you have to have type 2 diabetes, are almost treated with blood sugar lowering drugs, and the doctor is considering treatment with insulin. There are various insurance policies, and they are all different, but below you can see an indicative overview of the diabetes aids. They are reimbursed through all of the health insurance. The exact conditions are described on another site. But you can get an insulin pen 1 in 3 years, and also a spare pen, an injection pen in 1 in 2 years, an insulin pen and accessories 1 in 4 years, blood glucose meters 1 in 3 years, also number of test strips, but those are different for every diabetes person because the one person breaks more than the other. And ketone test strips, you get none unless you get this through the hospital. And yeah, I think that is our presentation.
I hope it was.
It's a lot of words, but maybe we can. Yeah, you have it already, but maybe you can send us your presentation, and then you can have this one. So the
That's
Yeah.
okay.
Yeah.
Yeah,
Then
I
you-
think that's
Then
okay.
you did. I will send you this week auch all agreement.
Yeah.
Okay?
Did you understand it or have
Yeah,
questions?
I did understand.
Die
Well
Situation,
done.
das war das about diabetes.
Yeah, I think it's like almost the same.
Yes.
Yeah.
There are not
Yes.
many difference in these two countries, I think.
I think too.
Yeah.
And now we have like to discuss what what do we have to discuss?
In Netherlands?
Yeah, we have to like discuss the difference or something.
Yeah, yes.
Yes,
But
but
there are not.
not that many differences. So like in Austria, there is 1 out of 10, and in the Netherlands, there is 1 out of 13, I think.
Yeah, 14.
14, okay, yeah.
14.
But I think it's, yeah.
But we have
Better.
1.1 million people
Okay.
more with diabetes, and you're under the million people.
Yes, but we're not that many persons in Austria here. Like our country is a little bit smaller.
Do you know how many people there live in Austria?
In Austria, there I think
I don't know.
8 million.
More or less.
I think 8 million.
8 million or
I have a look.
between
Google is
8
my
million
best friend.
between 8 million, 9 million.
Wait a minute.
Okay.
Well,
we have 17 million, so that's. I think that's changes the
more.
numbers also.
It's very difficult. Huh?
8.9 million, says Google.
Quite 9 million.
Okay.
Yeah.
Okay.
Yeah, we have everything. Do you have no
Yeah.
question about
Okay.
our work?
Yeah, we have to. Yeah. The next time, I don't really understand it well, but we have to do a presentation or something
Yes.
together, or
Yeah. That's what Lynn said. We already have our PowerPoint presentation, so you can just make new slides for your presentation.
Information about the situation in Austria that it can't help about our document, our page, but it's already, we can make it do it. We need no our presentation or document, Word document.
Yeah.
But we make it.
yes. But here also is student groups will develop a joint presentation that includes the follow. Yeah, I don't know if that's. Lynn, do you know how?
Ik heb het document niet voor me.
Yeah, the says that that we have to do a presentation, and that there must be an introduction of the team members, a brief presentation of the case study, discussion, the main points that we discussed about the case study, and a conclusion. Do you also have that in the assignment?
I can wait. So
Okay. Okay.
Yeah, I think we must work on our presentation. That this presentation includes every point of our things we need to discuss about. Like the first one, I don't know. I only have the German one open.
Two.
Like what Mary said before. These points we have to go through.
Yeah.
Okay.
And we have to adapt our presentation like that, I think.
Okay.
But I think that's not that complicated.
Is that a presentation that we have to do like all together?
Together, I think so.
Yeah. I think
maybe
so
compare the numbers and
conclusion.
Should we meet together and do the presentation, the work on the presentation together, or should we do that without each other and only present together?
Do you know? Do you know too?
Make it together is also fine by me, but maybe we can do it all together. So we first make the presentation, and after that we present it.
Okay, yeah, that's fine.
So it's just one meeting again.
Yeah, okay.
Yeah, and I think that that's the last thing we need to do.
Yeah, I also think so.
Okay.
Okay, but we can make an appointment for that for another time.
Yes.
Okay.
If you want that.
Yeah. Let's do that.
Yeah.
Say anything.
Well, we can next Monday again.
Next Monday. Next Monday. Next Monday.
Next Monday is a little bad for me because the whole day it's online
Yeah.
Okay.
school.
And Wednesday after 3. Wednesday after 3.
It's okay for me.
That's also okay for me.
For you too, Lynn?
Yeah.
Okay.
So 11 November.
Okay, 11 November.
Okay. Well then.
Well, it's
We,
Oh,
yeah,
this Wednesday
this
or
one.
next Wednesday?
Next time.
Next.
Yes.
Next.
Which Wednesday?
11.
Yeah,
11 or 18?
18.
Oh, 18? Oh,
18.
18.
oh Marjolein, dan kan het niet.
No, we 18 we have a class around 3.
Okay. Because 11 I have class.
Every day.
Ja, Marjolein, we kunnen wel 's ochtends.
Friday next week, maybe.
Friday.
The 20th. 20th.
20 November.
20. Yeah, we did that Friday weekend after 2.
I
2 o'clock.
It's okay for
it's a
me.
little bad for me. 19.
19 afternoon.
Yeah, then we can
After-
after 5.
After 5 is
Yeah,
okay
that's okay for me.
It's
Yeah?
okay for me.
Yeah. Okay.
So 19 at 5.
Okay.
19, 5.
We can make it. Okay.
Okay. Yeah, then.
See you soon.
Yeah, then we will see
For
you then.
that great meeting.
Yeah, thank you very much for your attention.
Yeah.
Yeah, thank you for listening.
For
Yeah.
listening. I send you the video.
Yeah.
Yes.
later.
See you next week.
Yes.
you.
Bye.
Bye.